to the Swiss Liver Patients Association, Swiss HIPAA. Today, with the interview with PD Dr. Joachim Mertens, Senior Physician Internal Medicine and Gastroenterology at the University Hospital Zurich and visiting professor at the Norwegian PSC Research Center, with the topic liver transplantation, patient support. Welcome, Dr. Mertens.
Thank you very much.
When does a liver transplantation become necessary?
Well, liver transplantation becomes necessary in patients who have a really advanced liver disease and who are at risk of liver failure. Liver transplant can also become important in patients who have liver cancer and where there is no other way to cure the cancer than to transplant the liver. And the third important group is all the patients who do not have a chronic problem with their liver, so no chronic liver disease, but who, for all various reasons, be it toxic reasons, genetic reasons, have an acute liver failure and really come into the clinic for the first time and their liver is not working anymore. So three important groups. The most important group clearly is the group with patients who have had a liver disease for a long time and who have developed liver cirrhosis and where we see the liver function is getting worse and worse and worse.
When is a liver transplantation not possible?
There are circumstances where a liver transplantation can be impossible. One reason is that we may come into a situation where the patient is so sick that at that time point, we cannot transplant the patient because they wouldn't survive the operation. Another reason a transplant can be impossible is if there are other medical conditions, other diseases that prevent a large operation as a liver transplant. So if there is, very severe heart disease, very severe lung disease, sometimes very severe kidney disease can be a reason that transplant is not possible. And also important, if there is a cancer that is growing outside of the liver, we know that transplant is not good for the patient because we know that cancer will then start growing even more aggressively because of the medication that patients need after transplantation that will suppress their immune system.
How is the patient accompanied before the operation?
So usually the way this goes is that most of the patients that we discuss liver transplantation with will have had liver disease for a long time and will have been in doctor's care for a long time. And what usually happens is that there comes the point where we see that liver function is becoming worse, and where we talk to the patient. I do this quite regularly, where patients are coming to me. We're having a meeting, and we say, "Look, we have the impression your liver function is becoming worse. I think we should talk about liver transplant." So that's usually the first step of care for the patient. Once the patient says, "Yes, I can imagine. This is something that I would want." Then what happens next is that patients will be invited for usually a 5-day stay in the hospital where they will be checked really from tip to toe, where they will be examined in all different directions, whether they are fit and healthy enough to go through a liver transplantation. Because as we said, this is a big operation and it's very strenuous for the patient. That is a 5-day checkup. And then after that 5-day checkup, there will be a conference for all the experts where they will discuss the results and they will say, can we do a transplantation? Is it safe to do a transplantation for this patient? And then when we come to the conclusion that this is safe and that this can be done, then the patient will be listed. And from the moment the patient is on the waiting list, there will be regular doctor's appointments with the transplant center where we check on the patient, where we discuss with the patient whether there are any questions, whether there are any problems, where we keep, doing checkups on the patient to see whether they are fit. And as the MELD score is going higher and higher, is increasing, and the patient is obviously getting closer to the transplantation, then we do more and more often we do make appointments to be sure that the patient is doing well. So there is a very clear and very close, outpatient clinic for those patients listed. And it's also an outpatient clinic that is run by a clinical nurse practitioner who's really like the first point of contact for these patients.
Mm-hmm. What preparations and support are important for the patients?
So apart from this checkup that we do, which is kind of a very medical thing, patients will also, during these 5 days, make the first contact with our, psychiatry department. And that always sounds like, oh God, why do I need to see a psychiatrist? The reason is that we really want to tell the patients that this can be exhausting times. Waiting is very exhausting for many patients, and that we do care and we are concerned about the psychology, about the health of the soul as well as the health of the body. And that we will have, this contact established for the patient. At the same time, these regular visits, the points of contact that we define here in the hospital, they all should serve for the patient to be able to get their questions out. Another important thing is that we talk and we try to involve families, friends, close contacts of the patients as much as possible, because we know that a transplant and the time after a transplant, especially, it's very important to have people around you who can help you, who can support you, who can cheer you up every now and then. So that's a bit what we think about.
Thank you. What happens? What scenario is followed in an emergency?
So if there's an emergency in the sense that someone needs an emergency liver transplantation because of an acute liver failure. So let me give you an example. You go and collect mushrooms in the woods. You collect the wrong mushroom. It's a poisonous one, and you may think, well, this never happens. That's not true. It happens once or twice a year in Zurich, that we have patients who collect mushrooms and get a poisonous ones, and then really have liver failure, acute. Never had a problem with their liver before. In that case, one important thing is that the patients come early in our center, because these patients can sometimes become very sick very quickly. And it's important that we can talk to them before they become so sick. Mm-hmm. And then the next thing what happens is they will get, they get an accelerated, a fast checkup, and then become listed as what is called super urgent. And they usually will receive a transplantation, if everything goes right, within 24 to 72 hours. These organs usually come, that's an important bit of information perhaps, these organs usually come from France, because in Switzerland we do not have enough donors that we could provide a patient within 24 to 72 hours with an organ. So France, being a much bigger country, that's where most of the emergency organs come from.
Important question. How do I get an organ donor card? For an example, via the family doctor or hospital or internet?
Anyway, everything that you said is the right way. You can talk to your family doctor, and hopefully he will be able to help you and guide you on. Obviously, Swiss Transplant is a very, very good resource on the internet, and you can, I think, even download donation passes from there. And then obviously, if you have contact to a hospital anyway, I do hope that you find one of the doctors or the nurse practitioners who will be able to explain to you what does it mean. There are often a lot of questions, so don't hesitate to ask a doctor or someone from the medical staff to explain to you what this is about.
Okay, thank you, Bert. Does every patient get the liver when they need it?
So no, unfortunately not. If you go and watch the talk that is online here, then you will find out that no, absolutely not. We have about 7% of patients who are waiting for a liver transplantation. 7% of them die every year on the waiting list because there is a much larger need for organs than there are actually organs here in Switzerland.
How are the liver distributed?
So the way this is done in many countries where organs are transplanted is that for the liver, there is a list. So there is a waiting list, and the waiting list is organized by MELD score. So if you, this is also something that is explained in the talk, but there is a score which gives us a feeling or gives us a measure for how sick the liver is. And this score, which is calculated regularly every month and is updated on the list, this score will give you an idea how sick is the patient. And the more the score, the higher the score, and the sicker the patient, the higher up on the list the patient will be.
What is the process and the support like after the operation?
So after the operation, obviously most of the patients, pretty much all of them, will go into rehabilitation to basically get fit again. We see all different ways how things go. If things go very, very well, patients will be on the intensive care for 1 or 2 nights, and then we'll back to a normal ward, and then be in the hospital for 2 weeks, and then go into rehab. And then after that, they will be in regular visits here in our post-transplantation clinic. Mm-hmm. We will see them more often in the beginning, and then less often when everything's fine and the patients are doing well. Usually when things are going really well and patients are really having no problems with their transplanted liver, we will see them once a year.
Okay. Now, my final question, as a specialist, what do you recommend and advise a patient to do before or after the transplant?
So first thing is really talk to your doctors, get all the information you need, be very well informed what transplantation means. All the pros and all the cons need to be clear for you. What you should do is really, and I tell my patient this, is think of the transplantation as kind of the plan B, the last resort. Sometimes patients come and they say, "Oh, no wonder I get transplanted. Everything's going to be so much better when I have my transplant." And I sometimes tell those patients, maybe you take it easy, because if your own liver is working and is working well enough, your own liver is always the best liver. Mm-hmm. But if liver transplantation really becomes necessary, I tell my patients to try and stay fit. Go out, do your walks, do physical exercise, stay active, because this is going to help you so much when the time comes for your transplant. And obviously after transplantation, again, stay in touch with your doctors. Be really precise on your medication. This is important because after the transplantation, and particularly in the early time after the transplantation, the medication that you receive that will suppress the immune system is very important, and really make sure that the liver stays healthy, the new liver. So be precise about that. And then again, stay active, live a healthy, try to live a healthy life. I personally know patients who have been transplanted 15, 20 years ago. who can do everything. You know, they run marathons, they go skiing, so if things go really well, then you can do pretty much everything after liver transplantation.
Thank you very much, Dr. Mertens, for your interesting and helpful interview, which is an additional important source of information for patients. Thank you very much.
You're very welcome.